It's Wednesday. I think it's March 57th. I'm pretty sure that there's going to be about 100 days in March this year. I appreciate the efforts that people have been making to make sure that that you're trying to protect yourself and that you're trying to protect other people in your community. So the reason why I'm on this morning, good morning, Erin Toberman, not in the kindness bee this morning. It was a long day, and I wanted to talk to my friends seriously about what happened yesterday. This is a cautionary tale, and I want to tell this to you, and I would like you to listen, because medicine and your ability to get care right now has changed. And I want to tell you my firsthand experience of going through getting access to emergency medical care yesterday for my friend, because this will affect you, and it may affect your family members, and it may affect your community. And so going back to what I've been saying all along, you need to plan, you need to prepare, and you need to make your medical emergency plan right now. So she had a pre-existing condition, and right before they decided that they weren't going to do emergency surgeries, she was scheduled for a surgery that was, probably in any other environment, it would be considered significant and important and need to get done. And her surgery was put off last Thursday, and there's no remedy. She just has to wait until somebody decides where you can have, regular surgery again. Surgeries are not being planned. They're not being conducted. They're not available. So my friend was told last Thursday that, and her condition is painful, and her condition will become less painful when she has surgery, so that it will remedy some of the difficulties that she's having in her lower GI. So she had extreme pain yesterday, extreme pain enough that she got on the phone with her regular doctor who was planning to do the surgery. He sent her to the hospital that he has admitting rights at, and that hospital was, and I'm not ashamed to say, it was HCA here in Clear Lake. So she was in so much pain, so she needed to go immediately, and she found herself at HCA in Clear Lake. And of course, all of the emergency room facilities, the entrances are shut off. You cannot go in, you can't just walk in. So if your baby is broken, you can't just walk in. A lot of times what they're saying now is, if you need to go to an emergency room, you need to call them ahead of time. You need to call them ahead of time and find out what are the conditions by which they will even let you in the building. She was brought in. Actually, there wasn't a line when she got there. They put her in a wheelchair. They brought her into a small area. They did bring her back into a emergency room area. They gave her a shot to make her blood pressure, her pain go down. They did a couple of ultrasound things. She was there for 3 hours. She only met a doctor that was not caring, who did not offer her suggestions, who almost made her feel like her pain was insignificant he was waiting. It's almost like he was waiting for the COVID-19 patient, and that she was almost a disappointment, and that if she wasn't a COVID patient, which she was not, that her medical situation was not, she did not feel like her pain and her medical concerns were even something that were important to this particular physician on staff, the ER doctor on staff. So she was told that she needed to go home, and she needed to take some Advil, and she just needed to, the condition she has is going to sometimes be painful, and that she needed to go home. She said, "How am I going to get home?" And they said, "Well, you need to call somebody." And she said, "Well, can I stay in here while somebody comes and gets me?" Again, she came from Galveston. That's like 45 minutes. They told her no. She was removed from the hospital, and she sat on the curb, in the parking lot. And that's when I got to talk to her, and she was in tears. And I said, "I will be right there. I will come and get you." when I found her, and I finally found the entrance, because all of the entrances are closed and changed. When I got to where their emergency room is, there were people in agony waiting to go into the emergency room who were standing outside on the sidewalk, 6 to 8 feet apart. Two of them laying down on the concrete. One person was laying down up in pain on the grass. There was no tent. There was no chair. There was no water. There was no one out there to do anything other than to tell them to stay 6 to 8 feet away. There was no out. They were taking one person at a time. I was shocked. I was honestly shocked. And when I picked my friend up, she was sitting on the curb. She was bowled over in pain. She was crying. I put her into my car, and then we went to go back to Galveston. And I said to her, who are your doctors? So we started to talk about all of the stuff that I've been talking to you about, having an emergency medical plan. Please talk to your doctor. Please talk to your regular GP and any of your specialty doctors right now. The rules are changing almost daily at hospitals, and what doctors are able and not able to do. What your doctor knows today may be different than what your doctor knows tomorrow about getting emergency care. I can tell you yesterday, you could not go to HCA emergency room and get emergency care. You can't. You can't. They're keeping that building. They want to keep everybody out because they're anticipating all of these COVID cases. And if you don't have a COVID case, unless you're, I guess, I don't know, have your head slashed open or you're getting ready to die, or I don't know what the circumstances are that they would open their door and actually give you medical care. But yesterday, my friend, she was between 9 and 10 on the pain scale, could not get admitted, could not get a CAT scan for some of the things that are going on in her body. And so she was put out. She was literally put out on the street. I was talking to my doctor. It feels like a third world situation right now in the medical field, and you have to make a plan for medical care. So we went back to the island. UTMB is also not accepting anybody you can't get into the hospital. You can't. Unless you're coming by way of ambulance, and the person that you already have a pre-admitting status, you are going to face they are going to do everything that they can to turn you around and send you home. And the thing is that they can't prescribe you the things that they can give in a hospital. So on our way to Galveston, I thought, what are we going to do? Her ability to access emergency medicine has changed dramatically. So what we did is she and I talked about what her insurance options were, and we went ahead and found an urgent care. There's an urgent care on the island called 24 Premier. They are wonderful. Before you go to an urgent care, call them ahead of time. Call them. Do not show up and surprise people. There's a time between when you're sick and then when you're getting there. There's time to make that telephone call. Make that telephone call and let them know you're coming. That way they know you're coming, and you can know whether or not they're going to let you into their facility. So we called ahead, and yes, they were able to see her. We talked about her, a little bit of what her medical history was, why we were coming in. They were actually a little bit relieved that it was lower GI pain and it wasn't a COVID case. We came in, we did all of our hand, face stuff, put on masks, and we waited. And within a couple minutes, we were able to talk to the lady at the front desk. And then, her insurance, she needed to have her insurance card available. She didn't have her insurance card. And so it just was fortunate. She had been there before, and they had a copy of her insurance card. Everybody needs to make sure that you have your insurance card with you. Take a picture of it on your phone, the front and the back. If you don't want to carry around that card, you want to make sure that you have your most current insurance card available. That is the first thing they ask for. That's besides your name and your birthday, that's the first thing they ask for. Make sure that you have your insurance form available, because that is going to be your barrier to entry. If you don't have an insurance card, you need to call ahead and tell them you don't have insurance and make arrangements for how you're going to pay for those services, because they may not accept you depending on what your insurance situation is. So please call ahead and don't waste that precious time. Make sure that wherever you're going will take you. So we were able to get into the back room. So at that point, I knew enough of her medical record, and we had talked about it, that when we got there and they put her on a bed and they started an IV, and her blood pressure was through the roof because she was in extraordinary pain. They gave her a shot of Dilaudid, which, that's some pretty heavy stuff. And so all of a sudden, she wasn't able to actually, it was interesting to watch her try to share her medical history because she was on a lot of pain medicine. So I, as an advocate, was able to get to the brass tacks with the doctor that came in. I was able to tell him about what her current medical situation was, what was supposed to happen on Thursday, what her symptoms have been in the past, what they are now, what had happened earlier today, where he could find her medical records, what doctors that she went to. They wanted to know what she was allergic to. They wanted to know what surgery she had had. They wanted to know what medicine she had been on. They wanted to know all of this really important medical information. If she had been by herself, she would not have been able to provide that information as succinctly as she needs to. If you are by yourself and you are medically compromised, write down, and I'm going to put a form on there. Fill out your medical history and write it down on a piece of paper. Write it down. If you are in a situation where you can't speak for yourself, when you go to an emergency environment, they need to know that information. They need to know what you're allergic to. They need to know what surgeries you've had. They need to know what organs may or may not be in your body. They need to know whether or not you've had any operations. They need to know if there's any metal in your body in the event you need an MRI. Somebody, if I were to pick you up and take you to the emergency room, I don't know that information about you. So I can only be so helpful. So the way you can be the most helpful to yourself is write that stuff down. Have it. Take a picture of it, keep it on your phone, and keep it on your dining room table, keep it on your kitchen table. In the event you need to call 911, you can just point to that piece of paper, say, there's my medical stuff. In the event they need to intubate you, in the event you can't speak for yourself, you need to write that medical information down so that a first responder doesn't have to guess this stuff and they don't end up giving you something that might actually harm you further. The other thing is that I keep talking about this HIPAA form. Make sure there is someone in your family that you have filled this out, and it is the authorization to disclose protected health information. A lot of these hospitals, if they do bring you into the hospital, you will not be allowed to, a medical advocate can't come with you. You have to do this by yourself. They're not going to let other people in to see you. They're not going to let me come in and be part of your intake process. If we had been in an emergency room, there's no chance they would have let me go in there, and I couldn't have provided that information to a nurse, to an intake nurse, or somebody who's doing her intake to tell her about my friend's medical history. The other thing is that if you have a copy of this HIPAA form and you have somebody's name on it, even me, I would be able to call if you found out your mom is in the emergency room, if you found out your son's in the emergency room, if you find out your friend's in the emergency room, without the written permission to get information about somebody, they won't even acknowledge that they have a patient there now because of confidentiality. Make sure, this is so unbelievably important. Make sure you have that HIPAA protected health information, that you need to have that filled out for at least a few people so that there are people that call in and check on you, and they have the legal ability to share your medical information and your status with them. I don't think my friend ever thought she wouldn't be able to speak for herself, but when they gave her that shot of Dilaudid, she got loopy and she had a hard time speaking for herself. She had a hard time being able to succinctly tell the doctor what it is that he really needed to know. She wanted to tell her about a story, and which I understand because she had just been through an emotional trauma at a different facility. But without somebody like me, without an advocate there, he might have tuned her out and not wanted to listen to her story, because what he really just needed was her medical information. So if you just have that, it saves the intake nurses, it saves the doctors so much time. A couple other things. She didn't take her phone charger with her. I know that sounds silly, but they don't have phone chargers at these facilities. While you wait, they are not going to help you charge your phone. They're not. Don't expect it. I believe you need to have a small emergency bag with you. If you believe that you might at some point end up in an emergency room for COVID or non-COVID emergency reasons, make a small bag. Put a power cord in there, put some water in there, put your medical history in there, put your HIPAA information in there, put a small blanket or a sweater in there because it's awfully cold. We were there just to check on her, and we were there for 4.5 hours. When you go, you're going to be there for a while. Make sure you have everything you need in order to be there for up to 24 hours. I would suggest even putting a toothpaste and toothbrush in there. Obviously, a brush. I think this is the new COVID hair, that you just do a bandana or a headband and you just look the way you look. And so what we did is we got her settled. They did some scans. They did some important stuff on her. We found out she probably has something more significant than they even thought of when they CT'd her a month ago to go into surgery last Thursday, which she didn't do. She has a new condition that's creating more pain. The problem with that now, so my question was, what do you do? What do you do? She can't go in and get this. He said, this is the doctor. They will not admit her. Why not? Because it's elective surgery. I said, but she's in pain and she has, these adhesions. She's got some growth. There are things inside of her that need to come out. And he said, unfortunately, there isn't anybody that is going to open an operating room for her right now. The risk is they don't want to get the operating room contaminated. They don't want to use all the PPE. They don't want to get especially the GI people, and they don't want the anesthesiologists. They have to deal with your mouth and your face. They don't have the ability to test whether or not you as a patient have the coronavirus. And because they can't test you immediately, they don't want people that may or may not, that may be. And the thing is that everybody may be COVID positive, because right now you don't know. So they are only taking people that are getting ready to literally die into an operating facility, because they are worried about infecting, the possibility of infecting all of the staff, infecting the operating room. The quote was, using all of that PPE for a surgery, and then possibly exposing people while she's getting better. I thought, what the hell? So what does she do? I said, what does she do? She's going to be in chronic pain, and this pain is going to flare up, and it's real pain. I mean, it's her blood pressure goes through the roof and she throws up. It is excruciating pain. And he said, I don't know what to tell you. How about that? How about that right now? We have COVID. Everybody's so afraid of COVID-19. You can't currently get emergency medical treatment. You can't. And you are just going to have to manage symptoms for everything else that's going on in your body that may need surgical or inpatient. They're not going to give it to you. They're not. I'm frightened about that. He said, so I said, she needs a decision tree. She needs to know. So he said, you can come back here for pain management. And now that he's seen her, and now that she has a baseline at that urgent care, I know now, my friend, when she doubles over in pain, when she starts to vomit, if her bowels aren't working right, she has now a couple of signals that she can go straight over to that urgent care, which is going to stay open, and they will see her and help her manage her pain. And they will also make sure she doesn't have a blockage. If she ends up having a blockage, that could kill her. But you can't know that on your own. What's the difference between being in pain and almost dying? And that was what he and I needed to talk about very, very seriously, while my friend was on the table and she was loopy on Dilaudid. And here's the thing. Most places are not going to let me there. So you have to have your list of questions that you can ask, because you're not going to remember if you're on any kind of medicine that's not going to allow you to form your sentences and form your thoughts. Write down a list of questions that you want to have answered before they discharge you. Say what. Just write them down. What are the prescriptions? What if I need to see you again? Who do I call? How do I access your health again? Are you going to offer telemedicine? How do I make sure that that my call isn't pain and my call isn't life-threatening? And unfortunately, in her situation, she's going to have to come back every time that she is in excruciating pain. And thankfully, she has a plan that she now has someone she knows she can go to, that they have a CT machine, they have the capability to be able to identify whether or not she needs to go into emergency surgery. And from that urgent care, with that information, with that data, and because we started yesterday, you have to have proof to have surgery. Now she is starting to develop a file of, this is proof that she may need emergency surgery. If the urgent care identifies that, yes, here's all of the proof, they could put her in an ambulance and they could send her to be admitted somewhere, and that doctor could talk to a doctor at a hospital and pre-admit her based on the proof that she had at the urgent care facility. I know this is long, but this has me so incredibly worried. This has me worried about your family. This has me worried about your grandparents. This has me worried about your children. This has me worried about my children. What if Nathan fell down and broke a bone? What do you do? What do you do? Right now, the only thing they want you to do is call. They want you to call them. They don't want. You can't get in a car and drive somewhere. You have to call them. And that frightens me. That scares me to death. The other thing you can do is you can call 911. We are not in normal times. You can't get in a car and go to an emergency room. Can't. And if you do it, you're wasting your time. And that's precious time to me. That's really important. So the best thing I think you can do, call 911 and I'd have somebody come out. That's exactly what I would do. And if you can wait, I would make sure you have all of your telephone numbers for your doctor, for all your specialty doctors, for your emergency rooms, for if you participate at UTMB, or if you participate at Methodist, or you participate at one of the larger systems, call the larger systems and say, what do I do? I'm diabetic. What do I do if I go? What do I do? Because they're not going to be able. Unfortunately, regular medicine doesn't matter right now, which is so incredibly concerning to me. I'm very concerned we're going to lose lives to asthma, that we're going to lose lives to diabetes, that we're going to lose lives to heart blockages, that we're going to lose lives to pain, to lower GI pain, they're going to want you to go home and they're going to try and dismiss it. And I'm enormously concerned about that. At HCA, they only did an ultrasound. At the 24-hour premiere, they were able to do a CAT scan. You have to identify ahead of time, what capabilities are you going to be able to have? What can you give me when I get there? Are you going to go, am I going to just be there so that you can send me away? Are you going to be able to admit me? What are your admitting priorities right now? There are some hospitals that are literally closed. They don't plan to have anybody. They don't want anybody in their hospital because they don't want their hospital contaminated at all. Can you believe that? There are entire hospitals that you cannot get into that are empty because they don't want to deal with this coronavirus right now, because it's not a moneymaker. What happens is then they're stuck with you, and then their whole hospital's contaminated, and then you could possibly contaminate their doctors and their nurses, and they have clamped down and said, this isn't the healthcare we're providing. It's unbelievable. And if I sound like I'm worried, it's because I am. Or if I sound like I'm urgent, I am. When I tell you, you need to fill out these forms, you need to write down your emergency medical plan, you need to call the people, you need to, today, right now, sitting here, think, oh my gosh, if I was having an emergency right now, what would I do? Who would I call? Write down the names and the telephone numbers of your contact people. If somebody gets to you and you can't speak for yourself, you need to have information written down so that somebody can read that. If you can't speak for yourself, in our world, my mom, she's she's done. We've practiced this. It took me 2.5 weeks. She finally wrote down 3/4 of the stuff. She still hasn't finished her medical background, and I need her to finish that tonight. But if she's by herself and somebody had to come and get her and she couldn't speak, the people that are coming to help you don't have any information about you. And if you can't provide that information verbally from a place that you're not loopy and that you're not in shock, or that you're not unconscious, make sure that's written down. Write it down. People are terrible mind readers. They don't know if you're allergic to latex. They don't know if you're allergic to sulfa drugs. They don't know if you're allergic to penicillin. They don't know if you're allergic to iodine. They don't know if you're allergic to something. Write it down. Write it down. Write down what your major surgeries have been. That became important for my friend because it turned out, because of her previous surgeries, it's creating this adhesions disease, which is creating all of this pain for her. That was important for that doctor to know. What surgeries have you had? What significant surgeries? About when? What is your normal blood pressure? Do you have any blood pressure issues? When's the last time you checked your blood pressure? They do check your temperature when you go in. They check your blood pressure. They monitor your oxygen, your blood oxygen monitor. Women, take the fingernails off. This blood oxygen monitor does not go through shellac and acrylic fingernails, even a couple of layers of regular fingernail paint. Make sure you have one finger that does not have fingernail polish on it. For all of the people in your house, they need to figure out whether or not your lungs are working. And one of the ways they do that is measuring your blood oxygen through your finger. And if your finger has layers and layers and layers and layers and layers of ceramic or acrylic and, like pieces of jewelry and stuff, they're not going to be able to figure out if you're getting oxygen. One of your fingers needs to not have fingernail polish on it because they can't read it. And they need to be it's way more important that somebody's figuring out if you're getting oxygen, whether or not you have a pretty index finger. This is not the time. Everybody's going to look like this for a while. Make sure that they can read your pulse ox. That's an important number for them, especially with this respiratory disease going on. Here's the thing. She's going to be sick and she's not going to feel well, and she is going to have to go day by day in her apartment where she lives, and she has to have a plan. This is why you need to have food in your house. She needs to not leave that apartment. Why? Number one, she's already compromised. Her body is battling all of this pain and all this stuff going on in it. She can't get sick. She can't get sick. She can't go into a grocery store. She can't be around germy people. Even with a mask, you can't do it. She's got to stay in that apartment. So what is she going to do in order to get food? And what if you don't have the money in order to order things? And what if the order isn't coming for a couple of days? You need to make sure you have food in your house that you can eat and nibble on even while you're sick for at least a week. I mean, hell, get like 10 boxes of saltines and get a big thing of peanut butter. There's protein and there's crackers. You want to make sure that you have access to warm water. Dehydration is a big deal. Drink more water than you ever thought you wanted to. Make sure you're drinking water. Dehydration is one of the big things about all of this. Make sure you have the medicine in your house you need when you need it, which is now. If you have prescription drugs, go ahead and refill it again now. Make sure if you have to stay in your house for 2 weeks because either you're sick or you got sick or you can't leave the house because you can't get sick, make sure you have everything in your house you need. All of the pharmacies are now, the major pharmacies are delivering. They will deliver your medicine to you. Don't leave your house if you don't have to. So I went to Walmart yesterday to get my friend the diabetes monitor, and I was very, very concerned. Once again, all of the things on the shelf that shouldn't be there are, and the things that aren't puzzle me. The Mucinex is not sold out. Y'all get some Mucinex. Make sure you have enough for each person in your family. Mucinex, it's the expectorant. You need an expectorant. Some people are getting Robitussin CF. Some people are getting, and Robitussin CF also has acetaminophen in it. So all you need is acetaminophen and the expectorant, and that's a 2-for-1. You can just get the Mucinex and get Tylenol to take. One's for the fever, and one is to make sure that that your mucus stays nice and thin, so that you can. So in the event you do get sick, you can cough productively and you can get that crap out of your body. You want to make sure, if you are feeling sick, make sure that you still walk around. The best way to die from pneumonia is to lay on your bed and don't move. You have to move. You're going to feel like crap. You're not going to feel like walking around. You have to sit up. You have to walk around your house. Through it, you have to take hot showers. You have to get that humidity in your system. You need to make sure you're prone, that when you cough, you're bent over. You have productive coughing. And if you have somebody in your house, they can help you cup and clap to make sure you keep all of that crap out of your lungs. But I really wanted to reinforce, if you need a medical emergency, make a plan now. If you have anybody in your house who is prone to being like an accident prone, is older, if you've gone to the emergency room once in the last year, make a plan, because your emergency room experience is not going to be what you think it's going to be. All of the rules have changed. You cannot just drive up to an emergency room and expect to be seen. It's not going to happen like that. You have to call ahead of time. You have to figure out if your insurance will take you. If you don't have insurance, you have to figure out if they'll even see you. You need to make a backup plan to an emergency plan. Be aware of all of your local, close to your houses, emergency facilities, who's doing what, where can you go for what. If you just have the throw ups, that's a thing where you can just call your doctor and you can do telemedicine, and she can issue Zofran over send you in a prescription, and you can either go pick it up through the drive-through or you can have it delivered. So you don't necessarily need to go in and see somebody for the throw ups. But if you have somebody with a broken arm, don't go to the emergency room. They're probably not going to take you for a broken arm. They probably aren't, because unless your broken arm is sticking out of your skin and you're bleeding, they're going to say, put it on a pillow, put some, keep it still. We're going to send you some pain medicine, and we're going to see if we can't see you in some other situation. You're not going to be able to go into the emergency room with that stuff. And it breaks my heart, and you need to be prepared. People with babies, call your pediatrician. Call them, because the pediatricians need to tell you what they think they know. And again, who decides you're allowed to go in, that decision is changing every day. So today, your pediatrician may think, oh, well, you can just go to this clinic. Tomorrow, that clinic may close, may change its hours, may change its protocol. If you are worried and need to make sure that you have the latest, just check the website, check in with your pediatrician. You pay for these resources, these services. Make sure that when you go to use them, you're able to access them. Make sure you have a list of the medicine that you are currently on, either prescribed or unprescribed. They're going to want to know how much per day you are taking of what medicine, over the counter and prescribed. You can usually go to your pharmacist and they will just print you a list, and you can take that with you, or you can go ahead and write it down. Look at your medicine bottles, write down what it says, take a picture of each one of them. If you don't want to write stuff down, make sure you have that information available in the event you cannot speak for yourself. Yeah, so yesterday my friend went to the emergency room, and they put her out on the curb, and they actually told her she couldn't wait for a ride inside of the facility. She needed to wait on the curb, and there was no tent. She was in the sun. She was in extreme pain, and she was literally sitting on the curb of the emergency room parking lot. The emergency room parking lot, outside, crying in pain with a prescription in her hand. That is the current situation of emergency medical treatment right now. So if you don't have a plan, I encourage you to get one. Please take the story from yesterday seriously. It happened. I saw it myself. I saw how complicated it is. All of the medical people I talked to yesterday say it's going to stay that complicated, if not more complicated. They are still anticipating Houston is about 2 weeks out from being absolutely overrun by or lower respiratory infections, which they're identifying as possible COVID patients. They're petrified of that. They're petrified of the contamination and the contagiousness of this disease. And unfortunately, right now, COVID-19 is deciding how people are going to meet your regular run-of-the-mill emergency medical needs. And that is frightening. That's very, very frightening. It's so important. You have to take care of yourself. And then you have to take care of the people in your immediate circle. So make sure everybody in your immediate circle is on the same page about what happens if there is a medical emergency, and share that information and make sure it is written down, because when you do need it, you're going to wish that you had done it. And the people that are trying to support you medically are going to wish that they had that information. This is a cautionary tale. This can and will happen to you. This is the current state of our emergency medicine. It is flat on its back right now. And what you are normally used to assuming is there and that is available, and what we've become accustomed to being available, all of that is different. It has all changed. You don't have the time to be surprised when you show up at the emergency room that the emergency room has changed. You have to understand that now. So you have to take care of yourself right now and your family and the people in your circles, and you have to figure out how to make sure that you have all of the medicine you need, over the counter and prescription. You need to make sure that you have enough food in your house, and not fresh fruits and vegetables. I'm talking canned items. I'm talking saltines. I'm talking tuna. I'm talking stuff that if you're sick that you're going to have to eat because you need some calories. Make sure that you have enough food in your house for a couple of weeks so that you don't have to leave if you don't want to get infected, if you are quarantined, or if you are medically told that you need to stay in your house. Delivery services are available. Use them. Favor Delivery, Favor Delivery is out there. HEB, in my opinion, in the future, now and in the future, they are going to be the main food distributor for Texas. If you're having a hard time getting stuff at Kroger and Randall's, it's because they're not Texas based. They are catching up on their stock. You still can't find Lysol. All you need, hot water and soap and water, and you need to make sure you rub it. The reason why they tell you to rub it is because when you rub it, it breaks down those little virus molecules, because what you're trying to do is squish them. So if you do it too fast, you may not squish the little. It's almost like popping a balloon. So the reason why they want you to vigorously rub is they want to get that soap and water and pop that little nasty COVID-19 virus. Okay, that's it. That was my day. It could be your day today too. So please be prepared. Please have your oxygen monitor at home. I can't tell you how important these are to have in your house. Please make sure you have a working thermometer. Please make sure that if you need it, that you have a working blood pressure monitor in your house, which will also take your pulse, your heart rate. Please make sure that if you're diabetic, you have your diabetic testing equipment that is available. They were only $9. Have a backup to your backups for everything. Make sure you have your over-the-counter medicine at your house. When you take those medicines, make sure you're being a good nurse and writing down every time you take your blood pressure, write it down, because you're not going to remember. Every time you take any kind of diagnostic thing, write it down. Anytime you take any kind of medicine, go to the back of it. Just don't say I took a Tylenol. Go to the back of it. Identify that it's acetaminophen and how many milligrams you took and what time. And then follow the directions on all of the over-the-counter and your prescription medicines. Make sure that you have a way to get to your doctor off hours. You need to have somebody that you already know that is your medical provider that you can call for the most up-to-date information that they have. Everything at hospitals and medical facilities are changing daily. The doctors do not make those decisions. The hospital people in charge of the hospital, they make those decisions. So what your doctor thinks that they know about HCA or UTMB or Herman or Methodist may be different tomorrow than it is today. So it's your responsibility to keep up with what is available to you in your community. So that's my cautionary tale from yesterday. Somebody wants you to be okay. That's me. I really want you to be okay. I want you to be well. I want you to plan. I want you to prepare. I want you to I want you to be thoughtful, because right now you can be thoughtful and you don't have to react. And because you don't have to react, you can go through your decision making and talk about it out loud with your partner, with your spouse, with your mom, with whoever's in your circle. Make sure everybody agrees, that they understand what they're going to do if there's an emergency. Make sure you understand who gets a call first, who's calling somebody else, all of that stuff. Make sure you have your forms filled out. Make sure you have a plan for the dog, and make sure that you have somebody that has the ability to access your home in the event you're not going to be home for 2 weeks, and make sure that you are prepared to have a little emergency bag if you need to go into a hospital. They're not going to let you out, and they're not going to let you out to get your iPhone charger. So if you think you're going to be leaving the house, take that bag, take a little backpack so that you can stay in the hospital for a couple of days and not have to have any. They will not let visitors. So whatever you take with you is what you're going to have. Wishing you well. If you didn't hear it from the beginning, go back to the beginning. It's an interesting day, and yesterday's stuff isn't the super emergencies. Things are changing, and what you think you know has changed. So make a plan, please. I'll see you later. Bye.